Hello and welcome, dearest audience. We are all familiar with this rhythm. But how often do we pause to check this rhythm in the rush in our daily life? How often do we notice the changes in its pace? We might tend to neglect our well-being too easily in this fast-paced world. But when it comes to diabetes and heart disease, ignoring the warning signs can have serious consequences. Today, I'd like to share about the most perilous two, diabetes and heart disease. Dearest audience, diabetes and heart disease are two inseparable duos, like storm clouds and lightning. They brew danger in the body's skies. Diabetes is a major risk factor for heart disease, with elevated blood sugar levels wreaking havoc on blood vessels and nerves, ultimately doubling the risk of cardiovascular complications. Globally, diabetes mellitus affects over 500 million people, and in 2024, Indonesia ranks the fifth in the world, with approximately 20.4 million cases of diabetes, with a prevalence of 11.3%, according to the International Diabetes Federation. This number is projected to rise to 28.6 million by 2050. And alarmingly, individuals with diabetes are 2 to 4 times more likely to develop heart disease than those without. Cardiovascular disease remains the leading cause of death among diabetic patients, accounting for nearly half of all diabetes-related fatalities. In Indonesia, where heart disease is already a pressing public health issue, effective diabetes management is essential to reducing cardiovascular risk. These alarming statistics underscores the urgency of addressing both conditions in tandem, not isolation, through the integrated prevention and treatment strategies. Well, dearest audience, addressing this dual threat requires more than isolated interventions. It demands a comprehensive, multidisciplinary approach, one that integrates expertise across clinical domains and fosters collaborations at every level of care. Doctors, nurses, dietitians, psychologists, and educators must work together as a team to provide comprehensive care, to prevent complications, improve quality of life, and reduce the mortality rates. There are 5 essential elements of this approach. Let's talk about one more. First, clinical integration is the pyramid. Endocrinologists, cardiologists, general practitioners, nutritionists, and pharmacists must engage in a coordinated care planning. These entail shared medical records, interdisciplinary consultation, and unified treatment protocols that prioritize both glycemic control and cardiovascular protection. Second, lifestyle changes. Lifestyle changes must be supported through structured programs. In this case, nutritionists and physical therapists play crucial roles in guiding the patient towards sustainable behavior changes, especially in eating habits and physical activities. These programs must be culturally sensitive and tailored to real-life context to be truly effective. Third, we must address the emotional toll of chronic illnesses. Stress, anxiety, and burnout can worsen physical outcomes. Mental health professionals, in this case, the psychiatrist or psychologist, and also peer and family supports helps the patients to stay resilient and engaged, which is just as vital as any medication. Fourth, technological innovation. It offers powerful tools for early detection and monitoring. Wearable devices, telemedicine platforms allows us to track blood sugar, monitor heart rhythms, and catch warning signs early. But these innovations must be accessible and user-friendly to all communities. Finally, the last but not the least, strong leadership and public health supports are also essentials. Governments, insurers, and healthcare systems must invest in prevention, early detection, and equitable access to it. Public campaigns and community outreach can close gaps and bring vital information to those who need it most. Well, dearest audience, this is the essence of multidisciplinary strategy, a unified, patient-centered model that addresses the complexity of comorbid conditions with precision and compassion. When we fail to recognize the interconnected nature of diabetes and cardiovascular disease, we, of course, risk missing the heartbeat, and the consequences can be profound. But when we listen, collaborate, and act collectively, we restore the balance, improve the outcomes, and safeguard lives. By adopting a multidisciplinary approach and working together, we can make significant changes in patients' lives, and we can save more lives affected by diabetes and heart disease. Well, ladies and gentlemen, let us therefore commit as clinicians, educators, policymakers, and families and friends to not miss a heartbeat. Let us build bridges across disciplines. And I'm Sinta Octaviana. Thank you very much for watching.